I think we'll want to go from the molecular and the basic to actually what happens within the patient. And the person we'll turn to is our own Professor Janet Treasure. Now, Janet could not be with us today. She's somewhere in Europe, so we have a recording from Janet. And she is the Professor of Adult Psychiatry, who is a world leader in eating disorders. In fact, her work, many would say, has been the foundational work in defining eating disorders and its clinical reality. She studied how cultural background, how early development, how life events and how personality shape the development of eating disorders and its outcomes. And she'll be talking to us today about the future burden of eating disorders. So there we are, over to Janet.
Hello, I'm Professor Janet Treasure from King's College London and a consultant at the Maudsley Hospital. So I'm going to be talking to you today about eating disorders, which I consider to be a paradigm of a psychosomatic illness. Next slide, please. So first of all, what are eating disorders? Now, there have been major changes over time in the different diagnoses that are encompassed in this heading, particularly since ICD-11 introduced binge eating disorders, ARFID, pica, and rumination disorder. Next slide, please. But aside from these, there's a variety of various subtypes of eating and feeding disorders that are sometimes just used by the press or which are almost emerging as newly accepted possible diagnosis. And I'm underlining here diabulimia, where people with type 1 diabetes get eating problems, orthorexia, where people have sort of clean eating with either good or bad eating. And then at the end, we've got reverse anorexia, which includes muscle dysmorphia, which is the type of problem seen in males rather than females, where there's concern about not enough bulk rather than too much, and a drive for leanness. Next slide, please. And just to indicate work at King's Health Partners and how we're dealing with these subtypes, the subtype of diabulimia, type 1 disordered eating, has really been looked at in great detail by my colleagues Khalida Ismail and Marietta Stadler, and they've been able to develop an evidence-based co-design new intervention for this type of eating disorder, even though it's not fully accepted. Thank you. Next slide, please. Now, there's a big myth about eating disorders that they only occur in females with high privilege. And this myth is totally untrue, as is seen by this statement by the Academy of Eating Disorders, where it states that eating disorders affect people of all genders, ages, races, ethnicities, body shapes and weights, sexual orientations, and socioeconomic status. And this was proved by a community study done in Camberwell. And there are these other studies that indicate some of these wider types of cases. Next slide, please. So let's think about the epidemiology and the changes that have occurred and the implications that this has in teaching us about the causation of eating disorder. Next slide, please. This just shows admission data for eating disorders, particularly anorexia nervosa from NHS England. And what you can see, there's been this steady rise since 2010 in the number of eating disorders. Next slide, please. And then you can see in the last few years following COVID, we have had this rapid increase, not just in the UK, but it's been internationally in the number of eating disorders. Next slide, please. Now, this is very interesting as it obviously has implications for etiology, suggesting that some environmental factors may be of relevance to the causation of eating disorders. So that these environmental factors we're looking at are the increases post 1970 that we've been seeing, and also the exponential increase post COVID. If I can have the next slide, please. And these cartoons on this slide just depict some of the environmental factors that are thought to play a role. So we've had over these 50 years this tendency to have body objectification, where a person's value is very much based on what they look like. This leads to social comparison, and the social media is a particular way of disseminating these ideas with likes and dislikes. If we have the next slide, please. And of course, this has led to weight stigma, and which is one of the last prejudices that's available and which can lead to alienation and loneliness in those who don't fit the current stereotype. If we have the next slide, please. But also at the same time, we have this concern about weight. We have changes in food technology, which seem to be the key factors in leading to an obesogenic diet. And so this diet culture whereby people try to diet, but dieting is more difficult because of these changes in our food environment, can lead to eating disorders. Next slide, please. Now, all is not doom and gloom, and these lovely ladies are all examples of what I call the superpower we have in eating disorders, because we are very lucky that people with lived experience have been very proactive in providing money, resources, ideas to underpin our research, and these have all been involved. If I can have the next slide, please. And some of the work that they instigated was looking at the genetics of anorexia nervosa. And this slide shows the current state of the art, really. And what you can see with these GWAS, these correlations between eating disorders and certain genetic profiles, is that there is an overlap with various psychiatric brain disorders in the green section at the top of the slide, particularly for obsessive compulsive disorder. But the surprise was the area below, in the lower half of the slide, the purple section, which are metabolic aspects. So we have a negative correlation with genes related to body weight. We have we have insulin sensitivity. We have low levels of the bad cholesterol, high levels of the good cholesterol. So there seem to be metabolic features involved. If we can have the next slide, please. But not only have they promoted new thinking about causation, but people with lived experience have been extremely helpful in developing understanding, developing treatment manuals, textbooks, etc. And King's Health Partners has played a huge role in this. If I can have the next slide, because this shows some of the books that are available. And as I say, they're often co-edited and authored by King's Health graduates. Next slide, please. So to conclude, so 52 years ago, when I trained at St Thomas's, I met eating disorder patients in the side rooms of medical wards. Now, post pandemic, again, there are cases in paediatric and medical wards because of this increased incidence and reduced specialist eating disorder resource. Uh, the Maudsley Hospital and King's have been very important in leading new treatments, particularly those related to early intervention. Maudsley based family therapy and Freed are two examples of this. An area that does still need a lot of development, though, is on more complex, enduring cases. And the research is needed about this group of people because current treatments aren't satisfactory, and we need more innovation. And what we know is that getting resources to research this group has been limited, possibly due to stigma, or what sort of illness are they. However, I don't want to end on that gloomy note, because we do have this superpower of the support and cooperation of people with lived experience. And they have really been key in shaping research and service developments, such as the genetic research, and which has revealed both brain and body vulnerabilities. And these individuals with this dual understanding of lived experience and physiology and psychology can really provide a great deal of help to others, and have done so. Thank you.